long.
So moving on to the whey protein. Everybody heard of a whey protein? So they did a little clinical trial on some people that were diabetic, and they gave them 50 grams of whey protein or a placebo, and then they fed them a very high carb breakfast, which was white bread and high sugar jelly. And guess what? Made a huge difference. That whey protein before that meal, their 3-hour postprandials were 28% less for the people who had the whey protein versus the placebo. Plus, their insulin responded earlier. They were more insulin sensitive, which is the opposite of the insulin resistance. So how can you use this? Dr. Patel's got a great story, but I always tell people, drink a whey protein shake before you go to a Christmas party or your favorite family dinner that you know they're going to be serving that macaroni and cheese that's to die for. Or you know you're going to be someplace and you don't know what they're serving. Drink a whey protein shake and enjoy your meal. After the meal. Postprandials after the meal.
Yeah, a couple hours after a meal, usually. So, my family took this to heart. My mom actually recently, a few months ago, had a knee replacement surgery, and she's diabetic. She is on insulin, and we were noticing her blood sugars were running quite high. She really wasn't even eating much because didn't have much of an appetite, but had just had surgery, illness, pain. All of that stresses your body and can even release cortisol, which makes you even make more blood sugar. And so what I started doing is we were making little smoothies for her with some healthy fruits, and we started putting whey protein in it, and noticed that her blood sugars started dropping 40 to 50 points a couple of hours after that, versus her just either skipping the meal or just eating small amounts of food here and there, and she felt much better. I think it helped improve her muscle strength and probably helped her recover faster because her sugars were better and she was able to get more energy to continue her therapy, I think.
And it can be whey protein, pea protein, soy protein. There's a lot of those good proteins out there nowadays.